Good morning, everybody. And on John's recommendation, I've already got the Vindies on my Apple Music, so I'll be listening to that a little bit later today. So how exciting. All right, so we're going to be talking about burnout and resilience in Ohio's healthcare professionals. So I'm the Associate Medical Director for Ohio PHP. I've been there going on 2 years now. Spent most of my career at University Hospitals, Cleveland Medical Center, and my board certifications are in addiction psychiatry and addiction medicine. I also have specialized training in motivational interviewing and Gestalt therapy. So there's two main learning objectives for today. One is to really describe the role of OPHP in supporting healthcare professionals. And the second one is to really kind of do a deep dive into the Ohio PHP survey that was done on healthcare professionals in 2021, right in the middle of the pandemic. And I'm excited to show you some of those results. Right. So first of all, who is and what is Ohio PHP? We are a 501c3 nonprofit, started as a group of docs that wanted to support their peers who were struggling with mental health or substance use disorders. We are independent of any licensing board. So a lot of times there's a misnomer like, oh my God, you guys are the medical board. We are not the medical board. We operate independently of them. We are authorized by the medical board and many other licensing boards to implement what's known as confidential monitoring programs, sometimes called safe haven programs. And any participants who happen to be impaired by mental health or substance use disorder, if they do end up falling out of compliance with our recommendations, we do have the chance or whatever to report them back to their licensing boards if it comes to that. So we sort of have this sort of dual role where we are really supporting the healthcare professional and at the same time helping to protect patients. So it's an interesting niche. So just to give you an idea of the breadth of what we're doing right now, there are 6 boards that have an active safe haven or confidential monitoring program. It's interesting, the medical board is the only one that uses the CMP initials for confidential monitoring program. Everyone else calls it a safe haven. Don't ask me why. For some reason, the medical board didn't like that terminology. So they said, no, we're going to be called the CMP. So it's like, okay. So right now we work with occupational therapists, physical therapists, and athletic trainers. That's the OTPT-AT board. Psychologists, the vision professionals, the veterinarians, the chemical dependency professionals, and everyone that's licensed by the medical board. We have several programs in development. It doesn't mean that we won't work with nurses or dentists or pharmacists. We work with them all the time. What it means is that there isn't a specific state legislation that, that basically calls a safe haven program into existence. We're actually working on that legislation right now for the nurses, the dentists, the chiropractors, the speech and hearing board, the pharmacy board, and EMT and firefighter boards. The only board that we don't have any current activity with and that has told us more than once, no thanks, we're not interested. It's almost like I guess I'll say they've kind of got their head in the sand right now. Like, oh, our licensees don't have that issue, which is a little kind of funny to me, is the counselor, social worker, and marriage and family therapist board. So maybe one day they will join join the fold, but no current activity there. Here's just a quick overview of the process. So we would receive a referral, whether that's a self-referral or a referral from a board. We would conduct something called a well-being screen, make recommendations. If all goes well, typically the licensee would say, okay, I see what you're saying. I got to do what you are asking to do. They'd follow our recommendations, and then they would enroll in the CMP or Safe Haven program. Certain percentage of the time, the person may say, nope, I don't think I have that diagnosis. I don't agree. I'm not going to follow your recommendations. We can try and provide additional, therapeutic options if that's, something we can do. And if we don't feel the person, rises to the level of severe impairment. But if impairment is identified and we think, hey, this person is a risk or potential risk to patient safety, then and only then do we make a report to SMBO, stands for State Medical Board of Ohio, but it could be to any other licensing board. So that's just a tiny thumbnail sketch of what we do at OPHP. So I'm going to turn now to burnout and resilience. So burnout, as defined by the World Health Organization, is actually a syndrome that's conceptualized as resulting from chronic workplace stress that has not been successfully managed. Personally, I like Dr. Maslach's definition. I think it's much more telling. And she says burnout is an erosion of the soul caused by a deterioration of one's values, dignity, spirit, and will. And so any of you on the call that has ever been burned out, and I include myself among that bunch, yes, that definition definitely speaks to me. So yeah, and of course, it's no surprise that Dr. Maslach is the person who actually invented the gold standard test for burnout, known as the MBI, or the Maslach Burnout Inventory. So it is something, I want to say it's like 20, maybe not even 20 questions. Might be 15 to 20 questions. It's like a little survey that you can take. And she divides the symptoms of burnout into three main buckets. The first one, of course, is the emotional exhaustion and just feeling depleted. The second one is called depersonalization, and that's where a person starts to feel mentally distanced from their job. They start to feel very negative or cynical related to their job. And then finally, the third bucket is low personal accomplishment, where the person just feels like, gosh, does it really matter what I do, from a day-to-day basis at my job? So just feeling like you're not being effective, and what does it all matter? So that's the way that burnout is currently measured. And so when you read about it, a lot of times that's what some of the symptoms will be based on. So what Ohio PHP had the opportunity to do a few years ago is we got funding from the national federation. So all of the state PHPs have their own federation, and so they donated, I don't think they donated, but we got funding from them, and so we contracted with a firm called Mighty Crow Media, and we said, all right, we're going to do a statewide assessment of all of Ohio's healthcare workers and look at their well-being. And so they started with a lit review, and they designed a survey to measure burnout, stress, suicide risk, and well-being. And they happened to do it right in the middle of the pandemic. And so their key questions were, do self-reports of burnout, mental health symptoms, and substance use differ from prior to the pandemic versus during the pandemic? Number two, what are the biggest stressors brought on by the pandemic? And number three, what were the, qualitative experiences, opinions, and barriers to seeking resources for support in order to manage pandemic-related stressors? So it's pretty ambitious study. So all of those 13 healthcare licensing boards that I showed you, they sent an email containing the survey link to everybody on those lists. And the survey was conducted in the summer of 2021 and ended up with a final sample size of over 13,000 individuals. And so that's what I'm going to show you today is the results of that. And what I've uploaded, in addition to my slides, what I've uploaded to the ECHO site is the two articles so far that have been published about this. One is specifically about physicians, and then the other one is about all healthcare workers. And I just saw that they published a separate paper just on the pharmacist's experience. So it's interesting that I think they're going to just be publishing, different papers as we go. So again, here's your age breakdown. Most of the people were between 35 and 65. You can see there. Gender, it was, most respondents were female. And then here, I can't see the numbers here, but I'm going to move this over here. Okay, so this is the demographics of household income, and just basically, going around the pie, starting up here at 12 o'clock. You can see here's the 2%, and then it kind of goes around the circle. So it's actually interesting. It sort of hits all across the board in all income levels. And then here's the interesting part about, I hope you could see this, where you could see what category they come in. So, and this makes sense because there's more nurses than all other healthcare professionals in Ohio combined. So that kind of makes sense that 42 or 40, almost 4,300 respondents were nurses. Then you had docs, pharmacists, the counselors, social workers, and marriage and family therapists, and then you can see on down. So it did have respondents from, every category. So 1 in 5 of those healthcare workers did experience being furloughed, laid off, or unemployed during the pandemic. And then in terms of work-related stress, these were the moderate, significant, or extreme stressors, sort of the concern of this, spreading of COVID-19. Half of respondents said, look, I don't have sufficient personal protective equipment. And 37% had an inconsistent schedule. Yeah. Reviewing this made me think back to those days, and I was like, wow, yeah. And then home-related stressors. Again, not having enough time with family and friends, a lot of worry, a lot of guilt about, getting their household members sick, and then just complete exhaustion. I'm too tired when I get home to basically do anything. So those are the home-related stressors. So then they asked, again, what percent of people are feeling emotionally drained every day during the pandemic, and they basically looked at pre and post, and so it jumped from 5% to 25% of Ohio's healthcare workers indicating that they were feeling emotionally drained every single day. So again, extreme, but again, that's what you would expect during the pandemic. And then similarly, and then I think this is sort of falls into Maslach's category of the depersonalization and the feeling distant. So there was a 347% increase in the number of healthcare professionals that reported not caring what happens to patients every day during the pandemic. And so in the dark blue, you can see the numbers, the percentage. So it's like 1% felt that way prior to the pandemic, and it was, it rose to 5%. So if you add those two numbers, 7% of people were feeling that either a few times a week or every day. And then in terms of healthcare professionals feeling down, depressed, or hopeless nearly every day during the pandemic. So you could see that, the first column is, I don't feel that at all, which is about half the group, right? But then what happened is that, 20% plus another, say, 15%. So that's a pretty big chunk of folks feeling down, depressed, or hopeless nearly every day during the pandemic. So huge jumps in that. And then in terms of increase in thoughts of suicide among healthcare professionals, it basically doubled. It jumped from 3% to almost 6% during the pandemic. Respondents also indicated an increase or a significant increase in their substance use during the pandemic. I think that's been borne out. I've read that a lot, is that there was a huge jumps in people's substance use during the pandemic, not just healthcare workers, just a lot, almost all of us, whether we were in healthcare or not, big increases in that. Unfortunately, and we'll talk about this and why this is, only 1 in 4 healthcare professionals did seek emotional support during the pandemic, and 14% reported receiving some sort of screening, assessment, or monitoring at work regarding the pandemic. And why was this? There were 3 obstacles. These were the top 3 obstacles to accessing support. More than half the people said, look, I don't have the time, so I can't make the time commitment. 40%, so a full 2 out of 5 people didn't actually know where to turn. So that's kind of a signal to us at Ohio PHP about getting the word out. And then 38% said it's cost prohibitive. I can't afford it. Now, this little data point was a little bit sad and shocking to me, but in terms of employee assistance programs, 30% of respondents said, hey, my workplace doesn't have an EAP. And 37% said, even if they did have an EAP, I'm very unlikely to participate. So I don't know if that's just, distrust or not feeling they have time, or I'm not sure, but I thought I was a little surprised by that. So I'm going to move into some qualitative data. I think this is very telling. It's only going to include a portion of the full data, obviously. So I'm just going to show you two of the open-ended questions that they asked. And at first they were analyzing each board separately. And then as they got into the findings, there was very little variation. So they said, okay, everything was analyzed in aggregate after that. So here was the question. Question number one, and then I'll show you question number two. If you could request one thing to help you in your job during the next pandemic, what would you request? So sort of the magic wand question. And then these were the themes that came up, and I'm just going to show you some snippets from the ones that are highlighted in bold, from communication, support, leadership, but also some of the other response themes, sort of appreciation and things like that. So interesting responses. So in the communication, there was 4 distinct themes, and I'm not going to read these to you. I'll leave each one up for about 10 seconds or so. So the first one is about clarity. So I may just read a little bit, but this kind of makes sense. Is can we have clear and consistent messaging about policies? And if you can remember sort of the chaos and confusion of what are we supposed to be doing and when are we supposed to do it? So you can see that was across the board. People from the medical board, nursing board, pharmacists, and the counseling board. Also in the communication category was transparency. Again, the quote that sticks out to me the most is the second one. Healthcare personnel went from being heroes to villains because people were very skeptical of everyone and everything, and the media really didn't help us, made our job harder. And that was coming from somebody that was a nurse. In terms of guidance, again, people feeling sort of overwhelmed, wanting guidance about telehealth, wanting guidance about PPP, financial aid. This one person from the medical board described it as a free-for-all. So I was like, yeah, I kind of remember that. In terms of education, better education to the public. Here was a social worker that really kind of went on a rant. Quit having unrealistic expectations of what care coordination can do for us. It makes social work the dumping ground because they don't know what else to do. So it's interesting.
And that is from the board that doesn't believe there's a problem.
Exactly.
Just to throw that out there.
Just ironic, right? And then in terms of themes about support, again, just things that you would expect, but it is interesting to actually read the data that people say. We're picking up the slack. It's exhausting. Stop adding more duties without adding more support. That kind of thing. Again, this one is extremely telling. Getting offered emotional support without fear or repercussions, or it being asked on a credentialing form or job application if you actually got help. So that kind of poignantly points out where folks are coming from. How about a mental health day with pay? Mandatory mental health days. 2 people said therapy dogs. So some interesting. I mean, again, and they're just picking out little things from thousands of survey respondents. Flexibility in terms of daycare, people that care for their grandchildren, people that care for their children. This person from the chemical dependency board said, being a single parent, working full time, being responsible for homeschooling my children was impossible. So do remember that as well. Everyone had to go to immediate homeschooling. In terms of support, trying to get support from their peers, wanting more connectedness and support from their coworkers. And again, similar ability to talk to peers without feeling my licensure, position, or job would be jeopardized. Again, from the counselor and social work board. So less camaraderie because everybody was sort of overwhelmed with concerns. Free health insurance for all healthcare workers risking their life. I'm like, well, free health insurance that's a topic for another day, but that was interesting. This person from the Board of Pharmacy said, hey, let's adjust the CE requirements and give us some slack there. And I do remember this. Telehealth wasn't being paid for at the same rate as in person, and then that all got shook up during the pandemic. And then again, a lot of things about leadership and being prepared. Having burnout procedures in place before it happens again. Making investment in trained personnel. Having a, quote, response to the real problem, not a reaction. So I'm going to shift gears now and talk about resilience. And again, this is a definition. I mean, there's multiple definitions and we can talk about what those are, but the American Psychological Association, I thought, is a good place to start with resilience being defined as the process of adaptation or being able to adapt well in the face of adversity, trauma, tragedy, threats, or any other significant source of stress. So it's how you adapt. And so the second question that they picked on to review is, during the pandemic, what is something that made you resilient? So what's something that contributed to your adaptation abilities?
Chris,
and again,
what's your thoughts about asking that question of our group before you move on to the next slide?
Oh, that's a great question. That is a great question. So either during the pandemic or now, yeah, if you guys want to either throw that in, out loud or in the chat, that would be great.
I'm sorry, what was the question again? Sorry.
Oh, the question. Oh, it's okay. During the pandemic, or even during now, when you're burned out, what is something that made you resilient or makes you resilient now today? Yeah, it's funny. I was thinking of asking the questions either like during or right after we're done. But I think it would be cool to see what people respond and how it's the same or different to what people were saying during the pandemic. So, I mean, I will say that if I had to pick one thing, it was probably that I had recently learned yoga pre-pandemic, and I kept on doing it during, and it was a true lifesaver for me. So something that really helped me make it through.
I'll be honest. I think I'm laughing with I use humor, but I think the number of people that were supposedly in charge even of my hospital and what they did and how they did it, and just looking back and laughing when I have to take them serious now.
It's funny. Yes. You'll see a similar response. Yes. Anyone else?
Yeah, we're seeing humor, game nights, which doesn't surprise me from Sarah because I've already figured that she's the ringer at any Trivial Pursuit game night. There's the constant eating, so some people did pick up habits. Exercise, dogs seems to be a theme. Demon Slayer. Okay, Sybil, do tell.
This was an anime that had a couple of seasons. By the time we got to it, our daughters were watching it in Toronto, and we were watching it here, and then discussing it. But there were many allegories or analogies that you could make from the heroes in constant pursuit of this this horrible human slaying demon and the pandemic.
Mm.
So we look forward to that every week to just put a little structure on the weekend.
Just count me as surprised that someone slays demons to help fend off work burnout.
I get it though. It makes sense in a way. All right, so
Pedro
let's.
said echo. So
Oh, the echo. Yes, we were doing that. Yes, that connection is helpful. Yeah. Yeah, so here were again some of the themes, and the ones I'm going to pick on are the ones that are bolded there. The ability to keep perspective, faith. Those are some of the things that I don't have specific quotes on. But again, these themes kind of make some sense too. Friends and family, the stability of having a job for the ones that were working, and that's kind of an interesting one. The ones that were working and being overworked, they were like, "Hey, I've got a job." Having therapists, meditation, remaining healthy. That was interesting to me. Avoiding catching the virus. It's kind of hard to do. You can't always do that. So I was like, okay, that's how the person, that's how they defined it. Verbalizing gratitude on a daily basis. Confidence that I was doing what I can to be part of the solution. This one actually gave me some pause, the middle one. Returning to the cis male gender role of the hunter-gatherer. I was like, whoa, interesting response. Get what you need, protect the young, and then come home. I was like, okay, back to basics. Somebody appreciated the lack of traffic jams. Riding their bikes outside even in the rain. And see there, Will, gallows humor. There it is. Helps even today, even without a pandemic. The gallows humor does help.
I mean, reusing the masks. Just keep reusing your mask. That was
it was unbelievable when you think about it, right?
It's okay this time.
Oh yeah. Sleep, always good. Sleep, naps, it's one of mine too. Making things by hand, especially if you could make it for somebody that you were disconnected to. I was like, oh, that's a cool one. This maybe was my favorite, my hoarding tendencies. Everybody came to me when they needed something. Do you need a haircut? I got you covered. You need food? I got that. You want to borrow a book? I got that. So getting support from coworkers, being able to work hybrid, and just learning to adapt to daily change. So again, just a little bit of a taste. I know we have a short period of time in which to cover this. There clearly is so much more that has been written about burnout, especially during the pandemic. But just to summarize, OPHP is an independent nonprofit that supports healthcare professionals through two major avenues: confidential monitoring programs and educational presentations. We did see that burnout is widespread throughout healthcare. So even pre-pandemic, and of course it worsened during the pandemic. And burnout risk is something that can be decreased by fostering resilience at both the individual and the organizational levels. And so I think, yeah, and then those are the three articles that I actually did upload already up to the ECHO website, so you can actually delve into it a little deeper. And I dare say they're going to be publishing more papers on it. So like I said, I just saw the one on pharmacist health. And so they may be going category by category as we go. So I'm going to stop sharing there.
There's a question from Ellen Robbins. Do you know if the law boards or accountancy boards have similar programs?
Well, I know law does. It's called OLAP, the Ohio Lawyers Assistance Program. And I don't know if the accountants have a similar board, but I do know of OLAP. They've had that for decades. They've had that in place.
So does anybody have any questions for Chris?